Good afternoon. Thank you for joining us. A BC ostrich farm continues its battle against a CFIA order to cull its birds. This after the farm was hit with avian flu last December. And it has the backing of some powerful U.S. voices, including Dr. Mehmet Oz, who was part of a press conference today. We'll hear more about that, and we're asking you, what do you think of the cross-border attention this story is getting? Plus, how are hotter summers affecting your job? The WHO has just issued a report on protecting workers from increasing heat stress. We'll talk about that after 12:30. I'm Michelle Elliott. Welcome to BC Today. Glad to be back here on the show, and thanks for joining us on CBC Radio 1, CBC Television, live streaming as well. And you can call us now. What do you think of the attention that the fight between the BC Ostrich Farm, ABC Ostrich Farm, and the CFIA is getting, even from across the border? You can call us 604-669-3733 or 1-800-825-5950. You can just hit pound 690 as well, or email bctoday@cbc.ca, and you can comment on our TikTok Live. Well, yes, the owners of an ostrich farm in Edgewood are continuing their fight to prevent their flock of nearly 400 birds from getting culled, as ordered by the Canadian Food Inspection Agency. That order was issued last December after there were dead birds at the farm that tested positive for H5N1 avian flu. And the owners at Universal Ostrich Farms insist that the flock is now healthy, but the CFIA says the cull is needed to prevent opportunities for the virus to mutate. And last week, the farm lost the bid at the Federal Court of Appeal. It's now taking its fight to the Supreme Court of Canada. It does have some high-profile allies south of the border as well, including U.S. Health Secretary Robert F. Kennedy Jr. and former TV personality and now U.S. Center for Medicare Administrator Dr. Mehmet Oz, who is actually offering to house the birds at his Florida ranch. Dr. Oz was part of a press conference this morning.
Oh, if these birds have weathered H5N1, avian flu, or others types of maladies for decades, there's something that we should learn about in that context. What is it that allowed these birds that we know withstood a H5N1 epidemic about 8 months ago and probably 4 or 5 years ago, has allowed them to recover and in fact have antibodies that they're putting in their eggs. So all the hens, Katie has told me, have now had eggs that have antibodies in them. So for that reason, these birds themselves are now resistant to getting the H5N1 virus, and that has huge scientific value to the global community.
Now, it's still unclear what those said medical benefits could be from ostrich antibodies and if the research is robust enough to back up those claims. We're going to talk with the director of the Center for Public Health and Zoonoses at the University of Guelph and a veterinarian as well in just a moment. But we are asking you on the open line, what do you think about this ostrich farm case capturing so much attention, including south of the border? And you can give us a call. Just hit pound 690 on your cell phone or dial 1-800-825-5950. You can just hit pound 690 as well, or email bctoday@cbc.ca. We are live on TikTok as well, so you can leave your comment there. My guest is Scott Weese, director of the Center for Public Health and Zoonoses at the University of Guelph, also a veterinarian. Good afternoon, Dr. Weese. Thanks for joining us.
Thanks for having me.
Well, what do you think of all the attention this story is garnering?
Oh, the story just won't die, I guess. There's a lot of misinformation. It's a really tough situation. There's a no-win situation here. There's no win for a lot of levels, including for the CFIA. There's a lot of complexity. But there's some big issues with animal health and with kind of the rule of law and the threats this might pose later on.
Okay. What are those threats? Let's talk about that. Why, in your view, is this cull needed?
Well, I think I'd back up even more is what's needed here. Why do we have a cull? Is we're worried about infected birds. Now, are these birds?
Okay, I think our connection is just frozen there with Dr. Weese.
To do what farmers have to do. The concern with this virus.
Are you there, Dr. Weese?
You're back? Yep.
Great. Okay. Pardon me. I think we froze there for a second, but we have you back now. So let's go back to what is the concern at the outset here.
Well, the concern is this virus can cause a lot of problems. Like we are in the middle of a couple-year-long avian pandemic, and this is predominantly affecting birds, but it can spill into mammals and occasionally spill into people. And historically, this virus, the H5N1 type, has had a fairly high mortality rate. So we're worried about this virus as it is, but more importantly, we're worried about flu viruses changing, which is what they do. And the flu pandemics that we've had in people, they originate from animals. And then we're in a bird flu virus mixed with another flu virus, and we get one that can transmit readily in people. So we're worried about this virus changing so that it can really rapidly spread through people and cause severe disease. And since it's a new virus to us, we don't have immunity from previous infection or vaccination, and that's a pandemic.
What the farm has argued and continues to argue is that the birds, the current flock, has shown no sign of disease, and what they would like is to have testing, which the CFIA has not agreed with since December. So, is there anything to that call for simply to have them tested to see if there is in fact avian flu among them?
Well, there is some logic to that, but testing has to be proper testing. I'm not sure they're calling for proper testing. We need to know whether these birds are shedding the virus. So it's been months now. Odds are fairly good this virus came and went. Problem with ostriches and some other birds is that they can be infected and we don't know. Chickens get very sick very quickly, and you know because most of them die in short order. That's not the same for all birds. So you can have transmission that keeps going through a group and the virus changes as it keeps transmitting. It's really unlikely in this group. So odds are pretty low that they're infected and infectious, but we have to know that. So testing them to see if they're negative would be a start. There's also the component here, though, what do we do with the farm, right? And I think you just can't say no harm, no foul. Let's keep the birds and move on, because avoiding this call and, not even recognizing, this started off when they first identified sick birds and they didn't report it, which is what's required to do. So all the way along, this farm has taken risks which could have put a significant threat to the public, to wild animals, and to domestic animals. And that needs to be addressed as well.
Okay. And in May, the agency did say that the farm had been fined $20,000 for failure to report the initial infection and deaths of birds. So that's what you're referring to there. And what about the claim today that we heard a lot from Dr. Oz, which was that there's the possibility of antibodies and that there could be an answer and possible medical benefits that these ostriches hold, and if they were to be called, those scientific opportunities would go with them?
That's a stretch. There's not really any evidence I've seen that these birds tell us much more. Sure, they're going to have antibodies, just like animal infected with anything. We can make antibodies really readily in chickens. It's very commonly done. In mammals, you infect an individual with a vaccine or with the disease, and you see antibodies. The fact that these birds have antibodies doesn't make them overly unique, and it could easily be reproduced. So it's interesting. It's a novelty that, for all the discussion about how important they are for research, no one's actually said what value we're going to get out of them and whether there's proper research being done, whether there's ethical research being done, which is another question.
Okay, let's take some calls here. My guest is Scott Weese, Director of the Center for Public Health and Zoonoses at the University of Guelph, and also a veterinarian. And we're asking you, in light of a press conference held today by allies, U.S.-based allies, prominent voices in the United States supporting an Edgewood ostrich farm that's fighting this cull order from the CFIA. And as well, it says it's going to the Supreme Court of Canada now in its fight, asking you, what do you think of all the attention that this story is getting, even south of the border? Our numbers again, 604-669-3733, 1-800-825-5950, or just hit pound 690. Our email is bctoday@cbc.ca, and our TikTok is live as well. Our TikTok live is up. Islander says, I wouldn't toss out potential science without further investigation, especially when it is public. Thank you for that. We have a call from Peter in South Slocan. Hi, Peter.
Hello there. Hi. Thanks for taking my call. I'm really concerned about this whole issue of these ostriches. I welcome the attention from the states, although I'm a little wary of Robert Kennedy Jr.'s input. He's not the most scientific person I know. Dr. Oz, I don't know, but I think it would be an advantage to follow up on what he is suggesting. Whether we move all those birds down to Florida is another question, but that's anyway, my sense is that the CFIA is sticking to its guns because that's what it's told to do. It's got rules and regulations, and these people at the farm may well have bent some of them, and they're paying the penalty for that. I think we're missing an opportunity. I think we need to save these birds. They are alive now. It's, close to 9 months since they were first detected and had a few of their animals die. And the remaining birds are still alive and healthy. Are we going to kill all the crows? Are we going to kill all the other animals around that could possibly carry bird flu? I think this is ridiculous. I really do. And I think CFIA needs to be told to be a bit smarter in their application of these rules and regulations. I have a PhD in ecology, and I just don't understand why we have to be so hidebound by rules when sometimes they don't make sense.
It's interesting. Yeah, okay. Good. Great to hear that you have the PhD in ecology, Peter. So when you hear that, this is the stamp out policy to prevent that's been in place by the CFIA because of the avian flu that has killed millions of birds. So what are your thoughts about the need to prevent the spread of avian flu?
Well, there's definitely a need, but first of all, have they retested these birds in the ostriches to check that they still have avian flu in them? I'm not sure that there's been any more testing since the initial set of tests. That needs to be done before any more animals are killed, or before any of these ostriches are killed, euthanized. So I really feel about that. There's crows and all kinds of other birds flying around this countryside all the way up and down the states. Yeah. And some of them will possibly be carrying avian flu and distributing it.
Okay.
We will get resistance to avian flu from the survivors who succeed to breed and produce progeny. And so avian flu will gradually become less endemic, less serious to the populations. And I really think that there needs to be a little bit more science involved here rather than just the rules. I don't believe that this is the most sensible thing to do.
Peter, great to hear from you. Thank you very much for the call. And that's Peter in South Slocan. Dr. Weese, a few points there, right? And I'm interested in what he had to say about wild birds, and that he said, what do you do with all the crows flying around? And we do know that wild birds are a source of avian flu. So how do you compare the strategy there versus what happens at poultry farms?
Yeah, well, there are multiple levels, I guess. The couple issues with wild birds versus domestic birds is you can't address wild birds, right? So you can only address what you can address. And domestic birds are a bridge from wildlife to us. So, I don't have a lot of contact with crows. If I'm a chicken farmer, I have contact with chickens. If I'm an ostrich farmer, I have close contact with ostriches. We've got that bridge there. And we've got the bi-directional side. So like I said, we're worried about this virus, but we're more worried about what this virus can become. And part of that is this virus meeting another flu virus and creating a new flu virus. So, a bird having a virus is one thing. A bird having a virus and a person in contact with that bird having another flu virus, those having contact together, that's the situation where we can create a new pandemic flu virus. So the closer we have contact with infected birds, that's when the risk really starts to come in more. So wildlife, it'd be nice to eradicate. In wildlife, we can't. This is going to be out there. All flus are out there in nature. What we try to do is contain that bridge with us and with domestic animals as much as we can.
I'm also interested in the point he made about the CFIA's policy here, and I've heard that a few times, that they're sticking to their policy despite what the science, as people say, as people have claimed. So, is there perhaps some transparency that's needed from the Canadian Food Inspection Agency, or more explanation, or do you feel that they have explained their position on this and what the reasoning is behind the need for this cull?
Well, I think, like I said at the start, they're in a tough situation because there are international expectations about what. So, ostriches are still currently considered poultry. So, the approach to ostriches internationally is considered to be the same as it is for chickens. So, the approach to chickens is eradication. There are some potential exemptions for high value situations. And, an ostrich farm like this just hasn't hit that bar. So they are following what their international expectations are. And, for a country that's going to be trusted in terms of our food safety, our food security, our export markets, and things like that, the international community has to trust that Canadian agriculture does what it's supposed to do to limit the risk to other animals and people when we're shipping food. So they're in a really tough situation. They're trying to balance a lot of different things. And they're paying attention to the lives of 200 some birds, but they're also paying attention to the lives of millions of other birds, as well as the economics of food production, export markets, and a whole range of other things that come into play.
Let's take another call here now. And Doug is on the line in Port Moody. Hi, Doug. Hi, Doug. Are you there? Okay, we don't have Doug on the line. Let's try James in Vancouver.
Hello.
Hi, James. Welcome to the show. Your thoughts on this story about the ostrich farm and the attention it's receiving?
Well, the attention that it's receiving is quite ironic, coming from an administration that's firing scientists every day, every hour, and gutting whole research projects and all of that, and to have them come up and tell us, and they're deniers. It's quackery. I believe that we should trust our scientists and our bodies for research, and that's what I think.
James, thank you very much for the call. Yes, and we talked about this, Dr. Weese, off the top, right? Your thoughts about the international attention that this is getting. But what do you make of the irony that James calls it, that the support is coming from this administration that has countered and is laying off scientists at various agencies as well?
Oh, they decimated veterinarians in public health and in the Food and Drug Administration and the CDC. So yeah, it is a bit interesting. And, I think you're talking about very high profile people who have very little to no expertise in avian flu and zoonotic disease in areas that they're talking about. And I think Dr. Oz may be very well motivated from the animal health side. Like there is a compelling human interest story in here. We've got birds that we want to see. And if he wants them, I think if the Americans want to figure out how they want to import birds from a quarantine farm and the disease that's internationally controlled, good on them, go for it. Like I've said before, like I'm not dogmatic on we should cull these birds, but I'm very much on that we shouldn't do no harm, no foul, because what we can't have is every farm that has a positive bird now just weaponizing the court system and saying, no, I'm not going to depopulate. We'll just stall. And then once we've stalled for 3 months, we're going to say we're good to go. So don't worry about us. Like that's how you don't control birds. That's how you end up not being trusted by the international community. So I think addressing the farm is one issue. Like for me, the perfect scenario is you test all the birds, which is expensive and tough, but you do it. If they're all negative, you seize them. The farm pays for all this. The farm has shown they're not appropriate to have the responsibility of handling livestock, and you find a home for them. If that's Oz's farm, if the U.S. wants to import them, good on them. But I think there's got to be something done so that we can appropriately control disease. And we can't rest on our laurels that we got lucky, that nothing bad happened here, right? You only get lucky so many times when it comes to emerging diseases.
Let's take another call here from Sybil at Palms Lake. Hi, Sybil.
Hello.
Hi, yeah. What are your thoughts about this story and the attention it's getting?
I really I would like to see those ostriches saved, and at the very least, they should be retested. That would be the only fair thing to do.
Okay. And what do you think of the attention this story is getting?
Well, as I was telling the lady that answered the call, the viruses don't stop at the border, do they? So.
We certainly know that avian flu was a big issue in the United States as well last year. Mm-hmm. Okay. Sybil, thank you so much for the call as well. John is on the line in Mackenzie now. Hi, John.
Hi, how you doing?
I'm fine. Thanks for calling in. What are your thoughts on this story?
Well, avian flu is a very serious thing. Takes out many birds. I feed raven grapes all the time. Right on my fingers at work up here in the north.
Okay.
And ravens are amazing animals, or birds, I guess, if we're going to talk about birds and ostriches. But ostriches don't fly. When I was young and I met one down in San Diego Zoo.
John, yeah, so you
camera.
saw an ostrich at San Diego Zoo?
Okay. So anyways, the important thing is the science behind avian flu.
Okay.
We've seen how it works, and it's very important that as a Canadian that supports the Canadian science, that we do control outbreaks. And when we control the outbreaks, we do get some science out of what comes after.
Okay.
So, of course, Dr. Oz is very smart in saying that, well, some birds have lived. And, of course, birds have been around long before humans. And
John, thank you very much. I'm going, and I think you got to. I hear your point, and I'm going to put your point to our guest, Dr. Weese here, and also just making a note that we are going to pause for a break here for our TV audience. But Dr. Weese, what he points to there, he talked about, ravens, and really, as you touched on, this personal connection, right, that people feel to the animals, to the ostriches, and perhaps that's why the story has really struck a chord among the public. But so how do you address that the emotional connection that people have to this story?
Well, it's tough, right? And I don't want to see them euthanized either, but I understand why. I'd like to find a solution, but I'm not sure a solution's available. And I think this is the disconnect we have sometimes with, we're going to focus on the couple hundred ostriches, but, we've had millions of birds that have died, millions of poultry that have been killed because of this. And, the ostriches are higher profile, but does that mean they're more valuable?
And so what do you think is needed? You talked about an outbreak, and outbreaks need to be contained. So what do you think needs to be the next step here then?
Well, it sounds like this is maybe going to the Supreme Court, so we're stalling this out even more. I think ultimately there needs to be a decision about whether there is any alternative to culling. Is that even on the table? It's not easy to do, though. The previous caller mentioned, let's just test the birds, and ostriches are pretty big. They're not the easiest thing to handle. And when go on the assumption they might be infectious, it's a lot of work. It's a lot of expense to just catch and sample the birds. There's a lot of expense in testing them, and then you hope they're negative. Like I said, ideally, I would like to see them tested and see what's going on, and then figure out what we can do from there. I'm not sure that's practical, though. And I really don't want to see as this farm continue to have animals, because they've shown from the very start that they cannot manage these appropriately, and there are a lot of other very kind of questionable things associated with this. So like I said, there's not a good answer to this. I don't think we're going to have a perfect outcome by any means. I don't think we're going to have a good outcome by any means. We'll hopefully have the least worst outcome. And I'm not sure what that is. And I don't know how we sort out what that is. Ultimately, the courts will decide whether the cull can go ahead, and the CFIA will decide whether the cull will go ahead. They have some loophole ability, but they are bound with international agreements. So we've got so many competing interests here. I think it's hard to say what we should do.
Really, really good to speak with you on this. Thanks so much for lending us your expertise.
Great, thank you.
That's Scott Weese, veterinarian at the University of Guelph, who specializes in infectious diseases, also the director of the Center for Public Health and Zoonoses. He joined us from Toronto. And of course, there will be much more on this story throughout the day here on CBC. You can just stay tuned to CBC Radio 1. Tonight on CBC Television, and as well online. You can check for updates, cbc.ca. It's 12:30 now. You're with BC Today here on CBC. I'm Michelle Elliott. Thanks so much for being with us. And coming up in our next half hour, we're going to talk about the hot weather that continues around British Columbia. It will continue this week. What does it mean for our jobs, especially if you work outside in construction, in agriculture, in fisheries? Let us know how the heat is affecting your job. And we'll talk about a new report from the World Health Organization that actually urges action to protect workers from heat-related stress. So we'll talk to Dr. Melissa Lem about that. Take your calls as well. That's coming up after this CBC News Update with Amelia John.
Good afternoon. Separate motorcycle crashes have killed 2 men in the Kamloops area. The first death was recorded shortly before 6 p.m. on Saturday. RCMP say witnesses tried to save the 18-year-old rider's life, but he did not survive. The other single-bike collision happened shortly before 10 p.m. on Saturday. A wildfire north of the Shandero Canyon neighborhood of Penticton is now classified as held. The fire grew to 1 hectare in size, but isn't expected to get any bigger. The BC Wildfire Service sent 17 personnel, as well as 2 helicopters and air tankers, to battle the blaze. The Penticton Fire Department is also on scene. And Environment Canada says the Fraser Canyon will bake under daytime highs reaching between 37 and 39 degrees this week. The Weather Office says the heat poses a moderate risk to public health. The heat is expected to persist until the latter half of the week. Heat warning also spans inland sections of the central and north coast, where the mercury is expected to hit 29 degrees in the Terrace and Kitimat areas. Time for a closer look now at the BC forecast. Along the north coast, clearing skies late this afternoon, high of 18. In the Peace, sunny skies with a bit of wind, high of 31. For the central interior, including Prince George, sunshine, high of 28. For the southeast, lots of sun, highs up to 35 degrees. For the southern interior, sun, a bit of wind at times as well, high up to 35. And along the south coast, an air quality warning remains in effect for parts of Metro Vancouver and the Fraser Valley due to smog and wildfire smoke. Sunshine with highs up to 31 degrees inland. And that's the CBC News from Vancouver.
Thank you, Amelia. It's nice to be back. I was away for a couple weeks.
Yeah, great to see you.
Yeah, and it was hot.
There was wind coming in
say.
this morning, and it felt like I was back in Australia, because when you get that heat sometimes with the wind, it almost feels like you're in an oven, right? It's just like this blowing hot.
Yeah, it's not helping.
No.
It's not. This is something I brought up with Rob Zimmerman, actually. I've been using those little neck fans, or like a handheld fan, just anything, right? Hold on to. But it's blowing hot air at you, so I don't know if that's really helpful.
Oh, gosh, you got to beat the heat somehow,
Yeah,
right?
somehow. Okay, showers, lots of showers. Amelia, thank you very much.
Thanks, Michelle.
That is Amelia John in the CBC Vancouver newsroom. We're going to talk more about the heat coming up in a couple of minutes here as well. And a lot of extreme heat events, of course. Now, Ottawa earmarking more than $5 million to help communities prepare for the effects of climate change with a Green Municipal Fund. Well, this morning, the Early Edition spoke with Vancouver City Councillor Rebecca Bly, who's president of the Federation of Canadian Municipalities.
Shoreline restoration around Kates Park in North Vancouver. There's climate resilient green infrastructure upgrades here in the city of Vancouver, funding around the Killarney Senior Centre, cooling and cleaner airspace upgrades. That was a project that City of Vancouver was able to forward with the help of this funding. Implementing water system and interconnection to protect vulnerable aquifer in the Cowichan Valley. That, of course, is local here in BC. We're looking at, actually, there was an implementation of a backup power infrastructure in Oliver, BC. I think one thing that's really important to point out is that for every dollar that we invest in adapting to climate change, we save $13 to $15 in those future costs.
As you've been hearing in the news, BC is in for another hot week with temperatures around 30 or even higher, depending on where you are in the province. And hotter summers are becoming the norm. Climate change is leading to more frequent and intense heat waves. Well, now the World Health Organization and the World Meteorological Organization say urgent action is needed to protect workers from heat stress in a warming world. And they've published guidance on protecting workers, particularly those who work in agriculture, construction, and fisheries, outside work, as well as people with chronic conditions. And we're asking you, how are heat waves and hotter summers affecting your job? And what do you think employers need to do to protect workers from extreme heat. You can call us now. Just hit pound 690 on your cell phone, or you can dial 604-669-3733, 1-800-825-5950. Our email as well is bctoday@cbc.ca. And we are live on TikTok, so you can leave a comment there. Dr. Melissa Lem is my guest, a family physician in Vancouver and president of the Canadian Association of Physicians for the Environment. Good afternoon, Dr. Lem. Nice to see you.
Likewise, Michelle.
How are you keeping cool?
It's not too bad in my home, I have to say.
Good.
That's where I am. I'm heading elsewhere to work later today. But the blinds are up. There's a fair amount of green space and trees outside my window, which we all know helps reduce that urban heat island effect. So I'm not doing too badly.
Good to hear. Yeah, I don't know if you've tried those neck fans.
I have a larger fan that I use. I don't have a neck fan yet.
Probably the bigger the better. Well, when we talk about heat stress, right, and people who have to be outside or who have to work somewhere where they are exposed to heat, can't go inside, what does that mean for them? What kind of impact can the heat have on a person throughout the day?
We know that workers are one of the groups of people who are at the highest risks from extreme heat, and we also know those include groups of people like the elderly, people with pre-existing diseases, people who lack indoor cooling, and young children. So this can cause a serious effect, and we know at the beginning of a heat wave, often we see a bit of a spike in heat illness because our bodies are not yet acclimatized to the heat, and then as the heat builds up day over day, especially as those workers are spending time outside, and especially if they're not heading back to a cooled environment overnight, that those health effects can build up as the heat continues.
What are the kinds of conditions that might actually occur?
Well, the one that we worry the most about is heat stroke. That's a medical emergency, and that happens when the body temperature reaches 39 degrees or higher, when the person starts getting dehydrated, dizzy, they can experience nausea and vomiting. But the biggest alarm sign is when their level of consciousness starts changing, when they get confused, or even if they become unconscious. And this is something that my colleagues in the emergency room saw during the 2021 heat dome, which we all, I'm sure, remember. They were literally running from room to room, intubating patients unconscious and having seizures from heat stroke. So if those sorts of symptoms crop up, immediately call 911 or get that person to a cooling center right away and cool them down as much as you can. But the step before that is heat exhaustion and heat cramps, where you might start getting some muscle cramps because of electrolyte imbalances. You might again feel a bit dizzy and nauseous, but not having that level of confusion or that high level of body temperature that you typically see with heat stroke.
You mentioned the heat dome. In 2021, have there been lessons learned there? I know we talked a lot about protecting the vulnerable, protecting elderly people at home. What about at work? Have workplaces looked to that as a kind of a wake-up call?
What I think we need to understand at this point is that global heating driven by fossil fuels means that this is likely one of the coolest years for the rest of our lives. And workplaces, buildings, policy, government need to take this seriously. So in terms of what the BC government has done, they have taken some steps to mandate kind of maximum temperatures within new buildings. They've launched air conditioning programs, but I don't know how much work there has been systemically on employers and workplaces, because typically they're seen as responsible for their workers. But something I think is really important, instead of taking this risk-based approach that currently exists within our workplace regulations, like through WorkSafe BC, by saying, okay, you as the employee and the employer decide based on certain criteria that you get to determine when the environment is not safe for your workers. I think there should be an actual kind of minimum temperature or temperature maximum, essentially, once it hits a certain degree temperature, indoors or outdoors, that a stop work order is issued, and that the employees can then go to, or the workers can then go to a cooler area so that they can stay safe and healthy.
My guest is Dr. Melissa Lem, who is president of the Canadian Association of Physicians for the Environment. And we're asking you, how does the hot weather, how do heat waves impact your job? What do you think employers can do to protect workers amid heat waves and hotter summers. You can give us a call now. We'd love to hear from you. Our numbers are 1-800-825-5950 or 604-669-3733. You can just hit pound 690 as well. Our email is bctoday@cbc.ca, and you can leave a comment on our TikTok Live as well. And so, Dr. Lem, what do you make of this updated guidance from the World Health Organization and meteorologists as well on how to protect what's needed to protect workers amid rising temperatures?
Well, I think there were some very important recommendations that came out, including measures to take within the workplace, and then also better education of health systems and workers and employers around the health risks of extreme heat. But I have to say, I looked through this report, and there was a glaring omission within it, which was that the word fossil fuels did not appear once in the report. And as we all know, fossil fuels are driving 80% of greenhouse gas emissions globally and within Canada. And if we don't stop pouring fuel on the fire of extreme heat by reducing our emissions and fossil fuel use, we can't adapt our way out of this. There's no way we can mobilize our building industry and our society fast enough to save everyone from extreme heat, which people call the silent killer, because it's not like the really obvious disasters of flooding or wildfires or wildfire smoke that are really in our faces and we can see, but it kills people, it harms people right in the community and at home. We know during the 2021 heat dome that workplace injuries from heat almost doubled during that period of time. And so this is a really serious, extreme heat is really serious for workers.
It's that kind of that tension or that balance, isn't it, between the adaptation part and the dealing with the effects that are already among us and dealing with the cause.
Well, that's right. We have to sprint as quickly as we can towards adaptation and mitigation, or drawing down of greenhouse gas emissions, because that's what's required right now. And I do want to mention something that many of our listeners may be familiar with, which is electric heat pumps. They don't release greenhouse gas emissions while they're operating, and they can also heat and cool your home with the same technology, instead of requiring, say, a natural gas heater or a methane gas heater and a separate air conditioning unit. And they're far more efficient electricity-wise. So electric heat pumps are one example of a technology that both adapts us to and mitigates the effects of climate change.
Let's take a call now on how heat events affect your job, or how they affect workers, and what's needed to protect workers. The WHO is calling for urgent action, and their new guidance, or updated guidance, focuses on protecting workers, and they particularly focus on workers in agriculture, construction, and fisheries, people with chronic conditions, people with low income, and saying that they are more vulnerable. So we're asking you, how are hotter summers affecting your job, and what do employers need to do to protect workers from heat stress? Our numbers again, 604-669-3733, 1-800-825-5950. Just hit pound 690 on your cell. That works too. Or email bctoday@cbc.ca. We are on TikTok at CBC British Columbia. You can watch and leave a comment there. And Basil is calling us first in Port Coquitlam. Hi, Basil. Welcome.
Yeah, thank you very much, and thanks for your guests. Welcome to CBC. I didn't get a name, but appreciate your being there.
Sure, Dr. Melissa Lem. Yeah, what do you think of the impact of heat on work?
Well, everyone's talking about, we got to have these air conditioners, got to have air conditioners in the car, and so forth and so on. And employees could make it fairly simple. It may be difficult for some workers if they're working with paper and electronic equipment, but what about just the simple fact of having a basin somewhere, cold water, somewhere, just outside if you're working outside in construction or inside, and just issuing cotton caps, hats, and cotton towels, and just soaking them in cold water, plonking it on your head, wrapping your neck and your body with it, that is a very effective way of keeping cold, and you just have to go back occasionally and cool it off again.
Right, and you're saying
rather than the expense of and the adding to the climate crisis by using air conditioners, which is really hard on the climate.
That is a concern with air conditioners.
Yeah.
Basil, thank you so much. Yeah, Dr. Lem, first of all, how effective are just things like putting cold towels around your neck to cool off?
Michelle and Basil, thank you so much for calling in. Water is actually a really effective way to cool down, and it's a low carbon way, as well as you mentioned, doesn't require energy typically. So this is something that I'll recommend to patients who don't live in homes that have cooling when extreme heat events are coming, is have water nearby. Mist yourself, drink water, stay hydrated. Dehydration is obviously a concern. Use those cool cloths and jump in the shower, jump in your bath that has cool water in it. Or if you're able to be mobile, head outside and walk or jump into the ocean or a lake. Water is really an effective way to cool down, but not everyone has access to to outdoor bodies of water. And sometimes temperatures can get high enough that cooling down with water is not good enough. So it's actually important for our governments, I think, to put policy in place to mandate the right to cool within homes, and also end new hookups of gas to new buildings, because we have the technology. We have electric heat pumps that are more efficient than gas and less polluting within our homes and drive climate change less. So anyway, I think that's an important part too, is make sure we have systemic policy to keep people cool now and in the future.
And I know that there's the concern around air conditioning, but Dana Cunningham on TikTok said we need AC in schools also, because that can get pretty hot for sure. So whether it's AC or what you were talking about, heat pumps, Dr. Lem. This is a really great question from Morgan, or a point from Morgan on TikTok. Thank you for bringing awareness for heat exhaustion and sickness, especially if you take medication, ADHD meds, anxiety meds. Morgan, thank you for that. What impact can that have on heat stress and your ability to withstand heat, or the impact of heat on you?
Are you asking me this question?
Yes, Dr. Lem.
Michelle? Okay, yes, that's right. Okay, well, we know there are certain medical risk factors that put you at higher risk of heat stroke and heat exhaustion. And as was mentioned, medications are one of them: diuretics, stimulants, antidepressant medication, anticholinergic type medication. So this is something I think that we need to have better education and awareness within the medical system of. Especially here on the coast, we're not used to on the west coast of BC, right on the coastline, experiencing these extreme heat events. But I think we need to kind of bone ourselves up on these conditions, and then also be aware of other factors that increase people's risk from heat, like being elderly. Being socially isolated is a really important one as well. We know that was one factor during the heat dome that increased mortality. And then also thinking about what kinds of environments your patients live in. We know another significant risk factor for mortality during the heat dome was lack of proximity to green space and tree cover in people's neighborhoods. So just being aware of their postal code, being aware of what's around them and what medications they're taking and other factors are in play can help us keep our patients safer.
Yeah, great points on TikTok. Thanks so much for putting those up. David is our next caller now in Sydney. Hi, David. Welcome to the show. What are your thoughts on how heat can affect our jobs?
Hi. Yeah, it does affect us. And I work in construction now, and we really don't have the option of having air conditioners
right.
since we're building the building.
Absolutely.
And we have to wear protective clothing and long sleeves, etc.
Oh, my goodness.
The one thing I did notice, I've worked in Manitoba and Nunavut and quite a few places. And in Manitoba, they generally have water available right on the work site. So it's easy access. You don't have to go to the foreman's trailer or wherever to access water.
Are you saying that's not the case in Sydney?
No, it's not the case in BC. I have never seen it on a job in BC. Even in Kitimat, it was an issue when I worked up there with trying to get water. It was kind of hard to get.
Oh, my goodness.
So we kind of grin and bear it. I've worked in pretty extremes from plus 55 to minus 167 or minus 67.
Yeah.
So I think you kind of have to adapt a bit. I don't have air conditioning. I live on a boat, so I'm not, it's nice and cool when I go back to the boat and sitting in the cool Pacific Ocean there. But during the day, it's a little stifling.
And you raise a great point there about the protective gear, and I wonder how much hotter that makes it for you. But I mean, there's a point there, right? Water availability and access to it, right at the site or on the spot. David, thank you so much for raising that. It's a great point. That's David in Sydney. Let's go to Mitchell in Chilliwack. Hi, Mitchell.
Hi.
Hi. How does heat affect your work?
A lot of I work in manufacturing in a factory, and a lot of these buildings are often repurposed. So the building I work in, for instance, used to be a building that made juice, so it has a large cold storage warehouse, which means that half of the building is insulated, like about a foot on every side of you.
Right.
So obviously,
how much hotter does that make things?
It makes it makes it quite a bit hotter. The heat also lingers, despite the night supposed to be when it should be cooling down. So when it's been 1, 2, 3 weeks of heat that we are going to start seeing more often, it's to a point where it can actually be dangerous for us.
Sure. What are some things that you think your employer or manufacturing employers and those who do set up in retrofitted buildings could do?
Maybe something involving incentives to maybe remove the insulation or put in like extractor fans or vents that help the heat out of the building. Something like that. I'm not entirely sure what you could do with those like retrofitted warehouses like that.
Yeah, it's a really good point, though. I imagine, with that added ventilation, what that does in terms of raising the temperature. Mitchell, thank you. Really good to hear from you in Chilliwack. We did put a call out, actually, to the BC Federation of Labor to see what they had to say on this. No one was available, unfortunately, but they have just sent us a statement. This is from Suzanne Skidmore, who's president of the BC Federation of Labor. It states, whenever there is a crisis, frontline workers bear the brunt of it, and the climate crisis is no different. Our laws and regulations haven't kept pace with our changing climate, and extreme heat is a growing threat to workers, from restaurant kitchens to farms to forests to construction sites to roadways and more. Workers need to know you have the right to refuse unsafe work, and that includes work where there isn't enough protection from excessive heat. So that's a statement from the BC Federation of Labor, from Suzanne Skidmore, who's the president there. Really interesting points, Dr. Lem, from these two callers at construction sites, access to water, and then even within working indoors, but in a retrofitted building where there's a lot of added insulation.
Well, it makes me think about the projections around extreme heat and who's going to see the most health impact. So interesting that the caller said that when he worked in Manitoba, there was water everywhere. And I think one of the reasons is because Manitobans are used to high heat. And so there's more air conditioning there. There are more workplace protections. Whereas on the coast, still, we don't have this idea that BC is a hot place to be on the coast. And so there's data showing that even though the coast is actually cooler and will remain cooler than the interior for the foreseeable future, that there'll be higher relative mortality and illness from heat because we're not as adapted, because we don't have AC, because we don't have water on job sites. So we need to start thinking about the fact that extreme heat is the #1 extreme weather-related killer in North America, and we are experiencing that right here in Canada and in BC. And I want to mention something else, actually, about workplaces and benefits from changing from gas-fired boilers to electric heat pumps. There was actually a new study that was just released by the American Lung Association this month that estimated that within the U.S., if they replaced about 33,000 fossil-fueled boilers in factories with electric heat pumps that can cool, that this could prevent over 70,000 premature deaths and over 30 million asthma attacks within the next 25 years because of reductions in greenhouse gas emissions, because of reductions in air pollution, and this will save over $1 trillion in healthcare costs. So electrifying everything is going to keep us cooler, it's going to keep our air cleaner, and slow down global heating, which is a triple win for human health, air pollution, and climate change.
You know, that statement let's read some TikTok comments here, by the way. Randy writes, every site should have a sun tent and a cooler filled with water and Gatorade. Thanks very much for that. The statement from the BC Federation of Labor talked about frontline workers. And, you know, we think about extreme heat and extreme heat events. I think about wildland firefighters and the health impacts that they face as well. And the BC Wildfire Service is working on policies, implementing policies to address those challenges. But how do you do that when your work is actually directly tied to being out there during these extreme weather events?
This is the catch-22, and I think a lot of people in public health are worried about this. What if we have an extreme heat event at the same time we have an extreme wildfire and wildfire smoke event, when we're telling people to shut their windows, to stay inside, but inside is too hot? And this is the reason why it's so important to cap greenhouse gas emissions, to stop approving new fossil fuel projects like LNG facilities, like pipelines, like hooking up new buildings to gas, because we're driving this issue of extreme heat while saying that we need to do everything that we can to protect people. Part of protecting people is stopping the problem in the first place by reducing our greenhouse gas emissions.
Dr. Lem, thank you very much for speaking to us about this. It is very timely given the weather we're having and this new report from the WHO and WMO. Thanks so much for your time.
Thanks, Michelle.
Dr. Melissa Lem is a family physician in Vancouver and president of the Canadian Association of Physicians for the Environment. Joanne writes us this email. When we experienced the long heat wave in 2021, we installed a heat pump and are so happy we did it. Our home is on the tip of Vancouver Island and southwest exposed. We were going for cooler car rides, which definitely was not environmentally responsible, but we had no place to cool down. And when we have these stretches of heat, I wonder what people do in the high rises in Vancouver that don't have air conditioning and can't open windows even to cool in the evening. Thanks very much for that, Joanne. Again, our email address is bctoday@cbc.ca. Send us your thoughts on heat and work, and more of your thoughts as well on the ongoing story around the BC Ostrich farm that continues its battle against a cull order from the Canadian Food Inspection Agency. Lots more on that story throughout the day, of course, here on CBC. I'm Michelle Elliott. Thanks for joining us here on BC Today.